Good afternoon, everybody. My name is Andrew Simone. I am the global CEO of FINCA International. I am so happy to welcome all of you to the first inaugural, but what I hope is the first of many, FINCA Ventures Prize Competition. First of all, a very warm welcome to our distinguished guests. Her Excellency, Dr. Elsie Kanza, the Ambassador to the United States from the United Republic of Tanzania. Thank you. Monsieur Frédéric Edem Hegbe, the Ambassador to the United States from the Togolese Republic. I don't know if he's still here. Okay. Thank you. He'll be back. We can applaud him when he comes back in. Mr. Said Nyenge, the Counselor, Economic Affairs at the Embassy of the United Republic of Tanzania here in Washington, D.C. And Mr. Andrew Buop, the Education Attaché at the Embassy of the Republic of Kenya here in Washington, D.C. So you can see that we have quite a few dignitaries visiting with us, and I think that that is just testament to their commitment also to the people from their respective countries who are competing in this prize, and we're so grateful for your support. So I am really excited that this is taking place at the anniversary of our 40th anniversary as an organization. And we have one of our founders in the room today who 40 years ago had this completely radical idea that giving small loans to people in poverty had the power to completely transform their lives. From that initial success, John decided that he was going to formally launch Village Banking to focus on women clients. Obviously, you all know the story of microfinance, that it spread very quickly around the world because it really inspired people to believe in how you could create catalytic opportunity through a very small loan. So John, could you please stand up so that we can celebrate you? Since John's original inspiration, FINCA has provided tens of millions of people with access to financial services that they would not otherwise have had access to. And we continue to serve millions of entrepreneurs around the world. But I think what we've also recognized over that 40-year history is that certainly FINCA's efforts alone are not enough. And that not only do we need more people who are trying to change the trajectory of people's lives, but we need more people who are thinking about it differently and thinking about it holistically. And that is really the genesis for this idea of this competition. We made the choice, and I cannot take credit for that, really it was David Weissman and John Elkins who were in the room, made the choice that FINCA International was going to invest in social entrepreneurship more broadly, and created our capability through FINCA Ventures to start to do that. We want people to have really bold vision. We want them to be disruptive. We want them to think differently about what the world can look like. It is not going to happen maybe even in our lifetimes, which is why we actually need to seed as many change makers as we possibly can and build a relay race to take on this big task. So to all of the competitors, I don't even want to call them competitors, do you? To all of the contributors to the change, thank you for your vision. You have the most amazing drive. We've heard from some of them already over the last couple of days. Sorry, my mic, I need to stop moving, which is not necessarily part of my DNA. But you have the same drive that John Hatch had. You know, I know for a fact that when he started FINCA, there was an awful lot of uncertainty, but he never saw anything but possibility, and I think that it's very much the same for you. Collectively, you, 12 people, have the potential to transform millions and millions of lives, and we want even more to happen. So we have 3 finalists in each of 4 categories. So we have Health African founders, we have health American founders, we have agriculture, also African founders, and we have agriculture, also American founders. And we felt that it was important to have a mix. The prizes are what we hope, are the start of something. And there are a lot of investors in the room, and we hope that those investors are inspired by you and help to support you in the future. So the first prize is $70,000. The second prize is $20,000, and the third prize is $10,000. But as I said, the real prize is the future investment and the future impact that you'll generate. There were 300 applicants who submitted for this prize. I think it was incredibly difficult to winnow it down to 12, and you will understand how powerful it is when you listen to the stories that we are presented in those 12 cases. I do want to make a point of thanking our judges. You can find their affiliations and their names in the, what do you call that thing? Program. But they are exceptionally talented people in their own right who have done a lot to change the face of social impact. I also do want to recognize the board of directors of FINCA International, as I said, who had the foresight to drive this kind of thinking in the organization, and particularly, of course, our chair, David Weissman, and John Elkins, who helped to found FINCA Ventures. So thank you. FINCA Ventures is a centerpiece of our strategy to scale social impact. Since we have founded it, we have grown the investment portfolio to almost $7 million, which is exciting. Half of the portfolio has female founders or co-founders. Whoop, whoop. Very important. We're going to talk more about that later when we have a short discussion with Greta Bull from the Gates Foundation. Collectively, the portfolio of FINCA Ventures has reached 12.4 million people in 22 countries last year, which is pretty impressive. And what I really like about it is, building from the initial efforts of our founders, FINCA Ventures is really focused on very early stage companies. So it is about identifying the visionaries who have the passion for creating social change and helping to seed their dreams into what we hope are highly impactful, scalable, and sustainable businesses. So, we know why we're here today, which is really to shine a spotlight on the critical importance of investing in social entrepreneurship that generates impact. What we want to do is celebrate every single person who presents to us today. So I thank you in advance for doing that. Thank you for being here. Thank you for being part of the journey.
If I suddenly collapsed right here on this stage, what would you do? You'd probably call 911, and within minutes, somebody would be here to rescue me. But if I collapse on a stage in Nigeria, there's no 911 to call. Instead, I would be rushed into the back of a car, rushed to the nearest hospital, and probably sent to another healthcare facility without receiving treatment. More than likely, I would die. Every single year, more than 1.2 million Nigerians lose their lives in different emergencies because they lack access to timely medical response. And the limited services that do exist are fragmented, expensive, and slow to respond. My name is Folake Owodunni. I'm the co-founder and CEO of Emergency Response Africa. I have a background in public health, and together with my team, we saw an opportunity to use technology to close Africa's emergency care gap. Emergency Response Africa is a service that connects anyone who is experiencing a medical emergency to the largest network of first responders, ambulances, and hospitals in minutes using technology. A user can reach out by a toll-free number or a mobile app. We immediately dispatch a first responder to the scene to begin providing first aid, and if needed, the patient can be transported to the hospital for appropriate care. Our system is made up of multiple applications that work together to ensure smart dispatching, seamless communication, and data transfer from end to end, making sure that patients can get the right help at the right time, and that the data collected helps to build health system preparedness and resilience. To generate revenue, we charge an annual subscription fee to corporates in high-risk industries, and we partner with insurers to keep their people safe. But emergency services are expensive and out of reach for most people. And this is why we also partner with the government to ensure that low-income and underserved populations can also have access to care. Since launching in 2021, we've addressed 4,000 emergencies across 6 locations in Nigeria, and we have a response network of over 200 partners. We've acquired 12 corporate partnerships totaling more than 43,000 lives and grown our revenues more than 6 times in the period to over 200,000. We are incredibly proud to be implementing our first public-private partnership, a $350,000 pilot project with the Edo State government, where we're training 170 community-based first responders and deploying ambulance services to more than 2 million residents. And the testimonials that we've collected from our patients speak volumes about the empathy and the speed with which we provide services. The truth is that emergency response in Africa is a significant untapped opportunity. The increase in disasters and public health emergencies, the rise in demand for public safety systems and data, and the shortage of local service providers make now the right time for this business. At scale, our solution can reduce the number of preventable deaths on the continent by more than 50% and save the African economy over $1.3 trillion. That's impact. We are currently raising $1.5 million in equity and grants, and we would use that money to generate additional public and private partnerships to invest in our technology and to grow our response network. The FINCA Ventures Prize will go a long way in helping us to achieve our vision. Over the next 2 years, we expect to address at least 30,000 emergencies and grow our revenue to over $3.5 million by 2028. This will put us on the pathway to impacting millions. I want to thank you for this opportunity, and I invite you to join us on this journey to transforming emergency response in Africa. Thank you.
Okay, I'll just raise for 1 second. Thank you so much. That was really wonderful. You're building a wonderful business. Could you walk us through your key differentiation from other ambulatory service companies in the country?
Yeah, that's a great question. So there are ambulances certainly in the country, but what happens most of the time is these are ambulances that are owned by a private individual or a private hospital. Oftentimes they will have 1, maybe 2 or 3 at the most vehicles in their fleet, and typically they would use it for their own clients. One of the biggest challenges is that if I want to find an ambulance that's available, I may end up calling, there's a social media post of someone who called 11 different numbers in order to find one single ambulance that was available. What we do is we essentially aggregate the available capacity by going and identifying and partnering with each of these owners to say, hey, when we have a case that's close to you, we can tell you that information, and then you can go and respond to that patient. And what it means is they get more business, but from the user perspective, it reduces the headache of trying to find who's available. One call to us, and they get what they need. And can I just add maybe one other thing? So I think the second layer to that is we believe in using community-based first responders. So we have what we call motorcycle medics. These are paramedics on a motorcycle. And if you think of a place like Lagos in Nigeria, which is very hectic in terms of traffic, it means that they can cut through traffic, they can get to the scene quickly and start providing care before an ambulance even arrives. Thank you.
Hi, Folaki. First of all, congratulations on a really good presentation. My question is about how you plan to scale your business, because you showed a chart at the end that has a very steep trajectory. Mm-hmm. And it strikes me that some of the customers that you intend to sign up could be quite tricky customers, public sector bodies and the like.
Yep.
So how are you going to scale the business to achieve those revenue projections?
Yeah, so there are sort of two steps to it. In the short run, definitely we will be targeting both public and private partnerships. On the private sector side, that includes financial institutions. We have a vision to be able to work with telcos, making it accessible to people through their cell phones. On the public sector side, we will continue to engage at what we call the subnational level, because we find that that is really where implementation takes place. So if we establish partnerships, with each state and grow in that manner, we'll be able to, create a stronger network. The other thing is, as we start to look outside of Nigeria, we really believe that there's I won't say a franchise model, but a franchise-like model that could help us to scale into these different environments that we may not necessarily at this point have the local knowledge for. So if we can find partners that will enable us to take the brand and the operational model and the technology and put them in these different contexts, we believe that we can create something that's very highly scalable.
Do we still have time? Oh, thank you, Falaki, as well, and thank you for the presentation. It's a very, very exciting project. Just on the question of differentiation, do you sometimes consider yourself an insurance company, or do you consider yourself a medical service provider? What do you see yourself more associated, or are you a medical Uber?
Mm-hmm. Yeah, that's an interesting question. We do not consider ourselves an insurance company in the traditional sense, that we're not necessarily underwriting and selling financial products per se, but in the sense that we are protecting people, we're keeping them safe from sort of eventualities, then yes, I think there's a bit of that in our model. Because we're also selling directly to corporates and we're partnering with insurance companies, what we offer is almost like an add-on or a rider on top of an existing insurance plan. As far as an Uber, yes, we certainly have that model, but it's not a pure Uber model. We do have a 24/7 command center that is staffed by our medical dispatchers, and that came from research that saw very clearly that people want a human touch when they're experiencing an emergency. They don't want to just press buttons. They need to know that somebody is with them along the journey. Okay, thank you so much.
Now, I'm sure that you've been adequately introduced to the burden of chronic disease and the very high healthcare costs in sub-Saharan Africa and even globally. So today, I just want to introduce you to the burden of healthcare in Kenya. So 55% of all hospital admissions in Kenya are attributed to chronic diseases. Now, we all know that chronic diseases by nature require long-term care, long-term medical care, and with the average cost of care in our hospitals being $60 a day, it's very tragic for a low-income family that requires long-term care, because this is not just affordable. So that is why you're staring at these very shocking statistic in your screen today of every new year, 1.5 million Kenyans being pushed below the poverty line by healthcare-related costs. But we are changing this. We are changing this at Benacare by building a large network of healthcare workers, mainly made up of nurses and physiotherapists, and then through our mobile technology, connecting them to patients in need of care nearest to them, such that if a patient is in village A, they get to have a nurse from village A to save on costs of time and travel. Now, this network of healthcare workers help us to deliver affordable, clinical, and supportive care to patients in need of long-term care in the comfort of their own homes. The patient's family pays Benacare an average of $10 a day, and then Benacare takes 30% and pays 70% as salaries and wages to the healthcare workers involved. Now, the next way in which we further lower the costs is by empowering family caregivers. In rural Kenya, when one family member is in need of long-term care, another family member is often available to offer untrained care to them. And these are majorly women, like mothers, wives, and daughter-in-laws, who culturally have to step up to do this. So we leverage this. And then we offer training on the basics of caregiving to these family caregiver, where upon training, they offer supportive care like vital taking, basic medication administration, wound care, and grooming to their patients. And then we only come in for service monitoring and clinical care at a cost of $2 a day. And then at the end of care, we then connect these family caregivers to paid caregiving jobs near them. Now, the next way, the third way in which we lower healthcare costs is by leasing out of home care equipment, essential home care equipment like wheelchairs and ventilators and oxygen concentrators to these patients so that we support their care at home, so that their families do not have to necessarily pay upfront for this equipment. Now, all these three actions have led to more than 50% in healthcare cost savings for patients and their families, a better quality of life for the patients, and peace of mind for family members to return to their income-generating activities. Since 2017, we have delivered affordable nursing, physiotherapy, and renal replacement therapies to more than 15,000 patients in the comfort of their own homes. And we have also offered free screening and health education to more than 73,000 people in our communities, where we are using these as a tool for brand awareness and impact as well. My name is now Monari. I'm the founder of Benacare. I founded Benacare while I was a student nurse to tackle this problem. We are a team of 18 in the administrative side of things, supported by a strong advisory board and complemented by a dedicated network of more than 3,000 healthcare workers. Thank you.
Thank you very much. That was a really interesting presentation, and it seems like you're doing a lot of high impact work on the ground. Given how intensive the work that you're providing, that training, working to monitor the patients, etc., how do you scale your product? What does scalability look like for you? And are you profitable right now? If not, what does it take for you to get to profitability? What is driving that profitability?
Okay, thank you. So for our main business, the one where we are offering nursing services at home, we only retain 30%, and it's very hard to also scale these amounts because then we will have to increase the costs for the patients, and this is exactly what we are running from. So what we are doing right now for us to be able to scale our profits and our revenues is we are introducing a new service offering that is very high impactful, and that is mobile dialysis for kidney disease patients. So last year we had research done together with the local universities on the modalities available for the treatment of chronic kidney disease, and this brought about gaps in patient care, and now we want to narrow those gaps for our patients by taking dialysis to the kidney disease patients at home. Now they will not be paying out of pocket because the government of Kenya, through the National Health Insurance Fund, pays for them about $150 a week for 2 sessions for each patient. And so we are looking at scaling through this because then we cash out from the National Health Insurance Fund and not from the pockets of the patients. And then this will be easier because then we are able to account for these and obviously lower our expenses. And then now we will look at profitability. But we are not looking at increasing the healthcare costs for the patients for that matter. Thank you.
Now, first of all, reading through what you do, I was struck by the huge positive impact you're having on women and on the society. So well done for doing what you do.
Thank you.
When the judges were deliberating the offering, one concern we had was liability. So as you're training and sending people into people's homes, who is ultimately liable if something goes wrong? Because if it is Benacare, then the concern is, will you be able to suffer much exposure if something goes wrong?
Okay, yeah, that's a good question. So for the healthcare workers that we send home, we do not train the healthcare workers. They are trained obviously by the medical facilities, and then they have licenses, and we have also an insurance called professional indemnity, and every healthcare worker that works with us also has professional indemnity as well to cover us on those issues. Now, on training of the family caregivers, what is happening is they're not doing anything medical, they're doing supportive care, which they're actually doing untrained at this point, and it has very bad outcomes on the patients. And also, when you do something untrained, you also have the burnout because you don't know what you're doing. So we are just empowering them so they can offer supportive care better. And the supportive care is like grooming needs, helping with pressure area care, basic wound cleaning, vital taking, which they are allowed to do, and basic medication administration like oral medication. So we come in for clinical care. So through our network of healthcare workers who have professional indemnity, who have licenses that we also do a background check on, come in and offer clinical care, and then they offer service monitoring such that the family caregivers can call and tell them, I think I saw a blood pressure reading that doesn't look good, like you said, so what should we do? So that is the kind of service monitoring we offer, so that we are working with them every step of the way, and then they get to pay $2 a day. And the reason for $2 a day means the nurse is able to handle a larger pool of patients, because the $10 a day, the nurse has to be there the whole day, and the nurse actually does 70% of supportive work, and then it's only 30% that is clinical. So we are reducing it by leaving supportive care to these people, and then we just come in for clinical care. Yeah. Thank you.
Good afternoon, everybody. My name is Neo Hutiri. I am from Technovera. We are based out in Johannesburg, South Africa. We are redefining convenience for patients on chronic medication. In 2014, I was diagnosed with TB. I was collecting medication at my local clinic. My biggest challenge was not my disease. My biggest challenge was the fact that I was losing 3 hours, 4 hours every time I needed to go collect. This is a reality for 22 million people in Southern Africa. South Africa has done really well in the context of eradicating the spread of HIV and AIDS. We've got 7.2 million people that are HIV positive that are on life-saving treatment. The fact that the medication is available becomes a challenge when the access to it becomes difficult. We have created a network of digital smart lockers called Bellebox, where we can take pre-packed medication, load it inside. It sends an SMS to a patient saying, Neo, your parcel is ready for collection. Here's a one-time PIN. Sort of like the Amazon locker for chronic medication. Our patients classify it as an ATM for medicine. The lockers are temperature controlled in line with regulatory pharmacy procedures. We are able to get the right medication to the right patient 100% of the time. We've got battery backup to be able to ensure that these lockers are sustainable. How we make money, we get paid a fee for each and every parcel collected from the locker by the National Department of Health in South Africa. In Namibia, we sell the lockers with a 5-year maintenance contract. We've deployed lockers across 20 healthcare facilities in Namibia, and we are starting in Botswana in partnership with the Ministry of Health and Wellness, that site. There are instances where we get paid for rental of lockers, and we do work with corporates that want to sponsor clinics and communities within their CSIR budget. To date, we have effectively gotten over 1,250,000 parcels collected through this network of 123 smart lockers. Our average collection time from when the patient walks to the locker is under 22 seconds or under 30 seconds, and that is in the context of increasing convenience for the patient to be able to improve adherence. We are seeing about 27,000 patients per month, and we've been able to save over 250,000 man-hours per month. On average, we are just under R500,000 per annum from a revenue perspective. We work with national ministries of health across Botswana, South Africa, and Namibia, and we have support from the Technology Innovation Agency in South Africa as one of our biggest funders, SAB Foundation and CDC in scaling the work that we're doing across in Namibia. From a team perspective, my skill, I guess I trained as an engineer in manufacturing, so we have a manufacturing component to the locker particular portion of our business. Piyush has software engineering background and a master's in software development, and we've built a team that is focused on client support, operations, and installations of these lockers. The goal is to be able to take it from 123 healthcare facilities to over 500 healthcare facilities. Part of winning this prize would definitely be a catalytic journey for us to be able to raise $2 million to be able to scale the work that we do. We are inviting you to help us in reaching more people and reducing the time tax that patients are paying when they have to go access their chronic medication. Thank you.
Thank you, Neo. That's very good. A very good presentation. And as I read your presentation earlier, I thought time is money, and if you can save time, you're making money. So I think it's a really good operation, and as you described it for yourself. Just a question, real quick one, regulatory. Do you have to give patients information? In the U.S., you have to, as a pharmacist, give information when they get their medicine. Is there any requirement by your company?
So when we started, and I pitched this to Pharmacy Council together with the National Department of Health, they gave me a 2-year journey to show that we can get the right medication to the right patient 100% of the time. And that was with a lot of oversight and also being able to show that there's no negative clinical outcomes in introducing this intervention. So you could say that we had a Hawkeye from Pharmacy Council together with the National Department of Health. We technically positioned the lockers as a service that the National Department of Health is doing. So we are not rendering the service to the patient. We offer the technology that the Ministry of Health deploys in their clinics to be able to serve their patient. The confidentiality is maintained in that. We have access to the data, but it is technically the data that belongs to the client, which is the ministry.
Neo, I think I like your product. It's a great example of how a very straightforward solution can have a very large social impact. But my question is around gender equity and impact. Can you perhaps talk a little bit about how you think about that, both in terms of your own management team and the customers that you serve?
Perfect. So about 67% of the patients that we serve are women in the context of the work that we do. And again, when you think about diversity in South Africa, like for instance, we had to think about representation out of the 11 official languages. All of us are from, I guess we represent 80% of the different tribes as a team. 2 years ago, we had a loan from one of our funders that effectively pushed us to say, hey, if you can get to 50% gender parity, you don't have to pay back the interest. And again, that's effectively us accepting terms that are effectively driving gender parity and gender transformation within our organization. And I like the fact that you are able to, I guess, exhibit it in the terms that you're accepting in building a strong management team that represents the 68% of the population that we serve. We are on that journey, and it's about making sure that our leadership represent the constituency and our implementation represents that as well.
Can I ask one more quick question? How much does a box cost to produce?
Okay. It's about just under 10,000 USD per locker. And then effectively we would sell it at around 15. Oh, thank you.
A few years back, I had a major problem trying to get my son's inhalers. I went from one pharmacy to the other, still no luck. Eventually, I had to get someone to import it into the country. It took me several months to get access to my son's critical medication. Africa has a deepening healthcare crisis. About 73% of the population, do not have access, cannot afford medications easily. And also 23% of medications are not readily available, where insurance companies, whether the patient is insured or not, do not have the right tools to efficiently deliver the medications to their patients. At One Health, we're an online pharmacy and healthcare platform that is providing that digital infrastructure to overcome these various barriers that they face in accessing quality medicines. So how does One Health work? So an order is placed online on our online pharmacy or via APIs that we share to our providers. And this medication is then routed to the closest pharmacy to the patient. where this pharmacy dispenses it for pickup or delivery. And then now the last component, which we have, is medication management. We provide automation, we provide medication adherence support, but also we provide micro-insurance plans for as low as $3 to ensure that they have some coverage on prescription costs, as well as some hospitalization cover. So since COVID, we've seen that the businesses need, especially insurance companies, need tools to efficiently manage their processes, as well as need for easier access to medication. With a sizable market of about 28 billion, Walnut is looking at an intersection between Nigeria and some other African countries. We make money from four main ways. We make money from markup on pharmaceutical sales, we make money from delivery and fulfillment fees. We get a take from providing complementary services such as doctor consultation and laboratory testing, leveraging the network of our partners. And also we get subscription fees for medication management services. Our product solutions, our in-house systems and domain expertise really puts us ahead of our competitors. An example is our logistics tracker. We have a system called Pill Mover. Pill Mover is able to track in real time delivery of drugs from the pharmacy to the patient. And the patient is able to confirm that order has been received and is able to take a picture of what they've received. This allows us to check for quality and ensures that the medication is delivered in the right condition. At One Health, we're providing over 100,000 visitors go on our website for access to information, to trackers, to calculators, and project recommendation. We currently serve over 20,000 enrollees and dispense over 10,000 prescriptions monthly. And we do this leveraging a network of pharmacy partners, over 8,000 pharmacies. We not only channel revenue to these pharmacies, but we also provide business support and growth. Our traction. So since we raised our pre-seed round around 2021 with 10x, with just 300,000 USD, we currently process over $500 million Nigerian naira, which currently is about $500,000, and we service big names like the Reliance HMO, one of the biggest HMOs in Nigeria. Leading the team is myself. I'm a pharmacist with over 10 years of pharma experience in business as well, and the core team in product operations and management. We're now looking to raise a 1 million seed round to really deepen our product offering to serve over 500,000 enrollees by 2 years post-raise. And we're currently backed by popular brands and names that you know that you can see on the platform. So we ask you to empower us to build for the future where no child or adult is left without access to quality medications. Thank you.
You mentioned both supply and affordability as the two key issues, and definitely see the idea of One Health and how it works, but how specifically do you secure supply and also make the medicines more affordable?
Absolutely, thank you. So our supply is pretty much in the aggregation of the pharmacies. We leverage the existing infrastructure of having physical pharmacies and being able to, aggregate them and make them easier for insurance companies, for providers like doctors, to dispense medication. So a lot of times, the doctors have prescriptions and they want to treat their patient, but they can't treat it consistently, right? Because they don't know if the brand is going to be available next month or the previous month. So that's what we do. We have a formulary that we already have that we've shared with these pharmacies, and we're able to ensure that it gets routed to the closest pharmacy upon availability, and the patient can pick it up. So that's how we get supply.
And what about affordability?
Affordability, because the insurance companies do have insurance. So what we do in terms of micro-insurance is just pretty much we serve as a channel to upsell those insurance plans and make it very affordable. So now we have an individual patient that does not have insurance is able to get it for $3 and still save costs on prescriptions, as well as get other services as well.
Sorry about that. Thank you for a great presentation. I think improving access to quality medicines is a critical issue, and many of us are thinking about how to solve this challenge. My question for you is, based on your application, it sounds like you all have significant partnerships within Nigeria, and you mentioned plans to expand or scale to Kenya and Ghana, I believe. correct me if I'm-
because
Oh, sorry about that. I got that wrong. Could you please discuss a little bit and provide more information about your plans to scale and how would you scale up going from here?
absolutely, and this is for us why infrastructure plays important, because we believe that there are a lot of fragmentation in the space. So by aggregating and providing that infrastructure, it's a matter of just taking that solution into the next country and having these partners on board. A low-hanging fruit for Ghana, for example, because we're just there, is pretty much us working with existing chains of pharmacies. They already do something similar, which is work with the insurance companies, but they're not effectively able to distribute to the last mile. So having them on our platform that allows us to, work with these chain pharmacies, as well as Global, for example, is in Ghana. They are looking for pharmacy partners that are able to get this medication from this pharmacy chain the last mile. So we're providing that interconnection and access to medications by partnership, as well as also, having an online pharmacy in itself. So there's no online pharmacy in Ghana in the sense of being able to go on our platform right now. You can go on there and you can get product recommendations via AI and bots. You can do your BMI and checks. We're pretty much the Drugopedia for Nigeria. So having that access for the last mile for an individual is what we're going to bring into these countries too. All right, thank you so much.
Good afternoon. My name is Sona Shah, and I am CEO and co-founder of Neopenda. We innovate needs-based medical technologies for emerging markets. An unbelievably large amount of medical equipment ends up in what nurses call the equipment graveyard in African health facilities. This is often due to power instability or dust getting into our equipment or unreliable supply chains. All this really means is worse care for patients. Far too many critically ill newborns end up in intensive care units and end up dying from preventable causes. I've been in wards where there's 150 people, so about as many people as this room, and only 2 nurses to help care for them. These nurses are not equipped with the tools that they need to identify who is actually in trouble and direct their attention most efficiently. That's where our first product comes in. This is NeoGuard. It's a wearable vital signs monitor that helps alert clinicians of patients in distress. Continuously measures pulse rate, respiratory rate, oxygen saturation, and temperature in a simple headband, and wirelessly connects to a centralized dashboard so a clinician can look at one screen and be able to tell what's going on with all her patients. What makes us really unique is that we are the only vital signs monitor that has been designed with and for users in low resource settings, that continuously measures the 4 vitals that we do, has a centralized dashboard, and is offered at 1/10 of the cost of comparable equipment on the market. We won't end up in that equipment graveyard because we've built our solution from the ground up. We've engaged with thousands of stakeholders and thousands of devices out in the field across multiple geographies. We started Neopenda in 2015 as biomedical engineering students who were interested in learning about the research and development process and learning how to scale our solution to multiple geographies. We've validated with these thousands of users, and we've set up esteemed partnerships with some of the world's most renowned organizations. We've set up a business model and spent the past 2 years really understanding and iterating on our business model. Our model is to sell in packages of 5 to 15 wearable devices. A tablet is included with our system at an affordable price to the end customer. We sell through distribution partners to both public and private health facilities in emerging markets that have inpatient wards. In Kenya alone, there are 3,000 of these facilities. We are able to make 60% profit margins on a sale of our devices, and this will only continue to grow as we hit economies of scale. We know our model works because we've already sold 1,200 devices in 3 different geographies, Kenya, Uganda, and Ghana. And we've generated over $400,000 in revenue in the first 2 years of sales. We're proud to have monitored and improved the quality of care for over 1,000 patients globally. Since we launched commercially in 2021, we have spent about 1.5 years focusing on what is that repeatable sales model and making improvements based on customer feedback. As you can see here, starting in Q3 of last year, we really hit our stride, and now we're scaling what we know already works. We've got an incredible team that is fully female founded and that is committed to gender diversity and equity, both with the products that we're creating, our users that we're serving, and within our team. We've got expertise in creating medical devices from ideation all the way through commercial sales, and we're not stopping with NeoGuard. We're building a pipeline of complementary medical solutions, connected medical solutions, starting with NeoSpot, our spot checking tool that is intended for primary healthcare settings, and NeoCloud, a data aggregation and visualization platform for a variety of users. So we're well on our way to becoming the medical device company for emerging markets, and we invite you to join us. Thank you for your time.
I was wondering, what is the immediate alternative that these facilities have at the moment before they consider the NeoPenda? Is there any?
Yeah, it's a great question. So the immediate alternative is actually not equipment. You think of the big patient monitors, maybe you'll find one or two of those in the nicest private facilities, but it's not accessible to a majority of the hospitals in emerging markets. So the immediate alternative is nurses manually measuring the vital signs, which of course is insufficient to detect when a patient is actually in distress. So providing them with an affordable but not free, nurses' time is perceived as free, that is what we consider to be our biggest quote-unquote competition.
Sana, thank you very much for the presentation. How much room do you see in your future strategy for software as a service as a part of your business model?
Yeah, we actually see quite a bit of that, and we recently were awarded a Gates-funded grant for AI, and so there's a lot of AI that can be embedded with the health systems. We're looking at this from the lens of NeoCloud, our data aggregation and visualization platform that allows us to aggregate anonymized patient data and generate unique insights for a variety of stakeholders. And this is where, we are looking at the software component as a SaaS model or recurring revenue, but there is also potential for immediate vital signs measurements or diagnostics that could be used as a software as a medical device.
Quick question to finish with. You're US-based, but you have a CE mark instead of FDA approval. How come?
Great question. So CE mark, for those who don't know, is the European version of FDA clearance. CE mark is most widely accepted in most of our markets. Our intent is to design technologies for emerging markets specifically. So while we are based in the US, CE mark made the most sense for the geographies that we're in. If we needed to apply for FDA clearance, we would get it because we already hold one of the most stringent regulatory authorities.
Thanks very much for the great presentation. Could you tell us a little bit more about your target customer? So you've mentioned you all are active at, I think, over 3,000 hospitals. Are those private facilities, government-run facilities? Could you tell us a little bit more about customers who are willing to buy this product?
Yeah, great question. And just to clarify, we're not actually in 3,000 facilities. There's a target of 3,000 facilities in Kenya, so just wanted to make sure. But they're both public and private. We originally started out in the private sector where there's higher purchasing power, less bureaucracy, so it's a lot easier for us to get in the door. But to really achieve scale, that would require knocking from door to door or engaging with networks. And so now we've started to engage with larger public facilities that have the ability to purchase and procure larger numbers of orders. For example, one of our more recent facilities purchased 40 devices, whereas a private facility might purchase 5 to 10. So it really depends. You have both the public and the private sector. Value proposition is a bit different for both, but to achieve the scale and growth, we're engaging some of those larger entities, which may include government, but is not limited to government given the fragmentation involved in that. But we'll also engage with distribution partners who then resell to the end customers. Thank you.
We live on a continent where 85% of the population is uninsured. And yet somehow we believe that if we continue with the traditional structures that exist for healthcare delivery, somehow we're going to cover this 85%. Take, for example, Fatia Kamweru, 62 years old, mother, grandmother. She runs a small eatery in Gong outside of Nairobi. And yet she is unable and struggles to pay for her husband's medical bills due to his chronic disease. Fatia represents 300 million plus small traders and informal workers on the continent who are uninsured and have no cover at all.
We got to fix this. On our team, there is me, Mocha, the doctor, our most influential Renee, Freak, our CFO, and Garang, the head of South Sudan. We realize that we are tired of seeing families struggle to pay when they have a bill, whereas we have the pill and in our experience, and we must change the experience and kill that. Households with informal workers and chronic patients have one bill away from poverty, and we are intent on changing that. We are creating the possibility of universal healthcare in Africa using the mobile phone.
Checkups Cover is a cloud-based, hyper-secure payments and health benefit management platform. We enable families to convert cash and pay for healthcare plans in ways that support their own earnings cycle. Our platform is available on WhatsApp, and it's available in local languages. Through our own house-built algorithm, we're able to 4x the value of what they pay into benefits that are distributed, as you can see above. We understand the African family structure, and therefore, we are agnostic about who joins in. Families can pay for their loved ones, their extended families, which is something that private healthcare does not allow for. Our cloud-based app allows us to geolocate, match, and dispatch nurses to clients. Using the data that we have collected, our doctors are able to make better diagnostics and therefore better outcomes for our patients, and we control the entire supply chain. So, what does this mean for families such as Fatia and Alex?
It means impact. Our members save 60% on medical bills. They are protected from borrowing when they are sick. 98% of our members get their first ever annual check on cover. Adherence to treatment is 89%, and 57% get their blood pressure dropped within the first 3 months. No hospitalization has been reported in households on cover.
So let's talk numbers. Traction.
14,000 households.
Revenue.
Over $10 million.
Customer acquisition cost.
$25 per household.
Lifetime value.
1,500.
Number of visits.
350,000 with 85% retention.
And the number of nurses on our dispatch.
300 dispatch nurses, most of them 96% females below the age of 35.
So what does this mean? In 2025, we will be reaching 100,000 members in Kenya and South Sudan, which makes us profitable. Right now, we're in discussions with banks to enable us to integrate our platform with theirs. Our platform could be licensed to NGOs and governments to help with universal health care costs.
With partners like IBM, we are fired up and ready to go. We seek to raise $5 million to make Checkups Cover the #1 health benefits management in Africa. Thank you.
Could you take us through your pricing? How much, on average, does it cost to have membership? And how affordable is it for your target market?
I would start and Renaud complete. We do not price. We allow members to invest in their healthcare. With 1 shilling, you can unlock $4. That means if you put 10,000 shillings, you unlock 40,000 shillings, which allows an average family to have access to the doctor with 10 consultations for the family, medication worth 5,000 shillings, laboratory services close to 15,000 shillings, diagnosis for 7,000 shillings. That is the magic. Our algorithm is based on our ability to calculate the cost of goods in the market times the probability of a certain disease happening in the population, which allows us to price aggressively and create savings for our members.
Just to correct that, it's $1 that unlocks $4, not 1 shilling that unlocks $4.
Thank you very much.
The other part of it is that our members are able to pay weekly, daily, or monthly. And this is what reflects their own earning cycles, because for the informal traders, they don't earn monthly like you and I do. They earn in these small amounts, and so they're able to unlock the amounts. As you can see on the bottom there, we have no exclusions. We do not exclude for pre-existing conditions. There is no age limit. There's no wait time, which means that if they pay today, they unlock the benefits today, which is what our clients need.
Thank you very much. But still, I would like to focus on the profile of a paying customer, average profile. What is it? Can you describe it? And also, how do you foresee it changing over the next, say, 5 years?
Our average customer profile will be a young family, probably about 4 or 5 under a scheme, which means under one membership. So our membership counts the one member representing the household. So when we say 10,000, it's actually more human beings than 10,000, but it's the one main member who is paying. Usually it will be a gentleman or more often a woman who is at work between the age of 30 to 45, who is a small trader in the market or a factory worker, and they will be paying about 24,000 shillings for the year to cover a family of 4.
To add to that, we are seeing a shift in the market. The Social Health Insurance Fund reimburses 1,000 shillings per beneficiary per year. That means companies are beginning to realize that the Social Insurance Fund cannot meet the needs of their clients. We already have over 200 corporates who are moving their low-end employees onto a platform, and that is quite amazing.
Yeah. So how much of the, let's call it maybe value chain, are you controlling versus using third parties?
We control the entirety of our value chain right from the start, where they engage in terms of payment, through the wellness, consultation, labs, diagnostics, medication, and last mile delivery. The reason for this is we started off with an iteration where we had third parties who were doing the service delivery, and the costs blew us out of the water. And so we realized that in order for us to be able to give the 4X and to create the savings that our clients so desperately need, we needed to control it. Now we're able to partner with others who will agree to work within the price range in which we are, and that helps us to be able to pass on that savings if we were in another country. But right now we control the entirety of the supply chain.
Thank you.
Hello, everyone. I'm not fluent in English, but this is my story. I have to tell it. Please bear with me. My name is Ida Solitoke. This is Kofi Nomeji. We co-founded Bao Baby as a solution that uses local vegetable to fight baby malnutrition. Our journey started a few years ago when I had my baby. It was very difficult for me to feed him because I did not have enough breast milk. The best alternative were to buy milk-based formulas that were very expensive for me and for millions of African mothers in the same situation. In my case, I had an idea to mix local vegetable to feed my baby, and he grew strong and healthy. So I wanted to share this solution with other African mothers in the same situation. That is when I met with Kofi, who was looking for a solution to improve female farmers' access to markets. We aligned our goal by creating Bao Baby as a solution that makes food system more inclusive for local female farmers and for babies. We have an innovative business circular model that uses mobile money to source crops directly from female farmers, transform these crops into formulas that are distributed back in local communities to feed our baby. We use drought-resistant crops such as baobab and moringa to increase farmers' adaptation to climate change. In terms of value proposition, our formulas are 3 times less expensive than milk-based formulas and contain more essential nutrients and natural antioxidants. Our products are distributed in rural and poor areas. This model makes our business financially strong. We have an average 45% growth and at least 15% net profit. We hope to scale to other countries in West Africa and get 5% of West African formulas market estimated at 1.7 billion per year. To get this part of the market, We are positioning ourselves as an affordable brand that distributes in both rural and urban areas. Our positioning helped us achieve a few milestones. We reached 3 regions in Togo and saved 30,000 children from stunting. This contributes to our social and environmental impact. Bao Baby contributes to zero hunger, better health, and we empower women through resilient farming. To achieve this result, we are a core team of young specialists in rural development, business management, social marketing, and food science with a combined 25 years of experience.
We are currently raising $500,000 to improve our product, improve our marketing and production. The FINCA Prize money will be specifically used to improve our formula and get some international certification that will allow us to expand to new countries and also help more female farmers. This certification will also help us establish partnership with 8 organizations to provide baby food as emergency response in areas affected by war or climate disaster. This investment will help us triple our revenue, help hundreds of thousands of babies from stunting, and also more than 2,000 female farmers, along with having more environmental impact on our communities. All this can only be made possible through our current and future partners. So let's work together to fight baby hunger. Thank you.
Thank you so much for the pitch. I was wondering if you could tell us a little bit about your profit margin. You mentioned it's around 15%. If you could explain how you get to that and also how you see it evolving in the next 2 to 3 years.
Yeah, our profit margin exactly is 15%. So it comes down from like the cost of goods. 20% of what we are making goes to the female farmers through fair trades, and then our production comes in, and also the distribution, the marketing and distribution. So that's how we get 15%. And in the future, as we scale, we hope this margin will move from 15 to 22 or 23%. Thank you.
Thank you. My question is related to this one as well. So as you grow your business, how do you increase your profit margin? Do you do that by lower your cost, or like how do you scale and increase your profit margin?
Yeah, we expect to scale and increase our profit margin by lowering our costs, especially in the distribution sector. So currently part of this we are distributing, and the other part we are also distributing through existing food channels to reach rural areas. So as we scale to other countries, we are expecting to work more with local health centers and also work with existing food distributors that will lower our distribution costs, since we'll be retrieving from that area.
Thank you. Great presentation. I just wanted to know how you do your quality control of your products. I mean, the grains that you are sourcing and the baobab powder, they have some anti-nutritional factors. How do you deal with that?
Yeah, the quality control, we work with the National Health Institute in Togo. So their laboratory is a very top-scale laboratory that helps us control the quality of our grain and also make sure that we have a good product quality. So their certification is very helpful on the Togolese market. But moving forward, we are planning to have our own laboratory in order to check the quality control, as we are also planning to get more international certification in order to be available in other countries.
Thank you. Wonderful product and impact, I imagine. Can you talk a little bit about the daily cost? What does it cost for a mom to feed their baby with your product on a daily basis? And where does it fit in? Is it the only thing they feed them, or is it complementary?
Thank you. So our product is for babies from 6 months up.
And our product comes in as a baby formula that can be very useful for the mothers who do not have enough breast milk, or the demand of the baby is getting higher as it grows up. So in terms of costs, the alternative for mothers will be to use milk-based formulas. And those are very much expensive. They are between $3 and $10, and ours is $1. And for that $1 pack, they can feed a baby for 2 days. Thank you.
Angela Odero. I'm a co-founder and the CEO of Rio Fish Limited. We're a private limited company in Kenya. We're majority women-owned, women-led, and we serve mostly women in the fish value chain. I come from a fishing community on the shores of Lake Victoria. In my community, the men are the fishermen and the women are the traders. And there's a scarcity of fish, which is currently compounded by the lack of an organized market and adequate access to cold chain. This same scarcity has led to the sexual exploitation of women traders when they seek fish supply by the predator fishermen. At Rio Fish, we provide a way out. Our solution is simple. We have a 300 metric ton annual capacity cage fish farm on Lake Victoria. We also partner with smallholder farmers. We give them access to cold chain, and we also give them access to technology. Our operating model boosts fish farmer production capacity, specifically the smallholder fish farmers. We do this through training on proper fish husbandry. We give them access to tools that help them with that, and then we aggregate their fish. In this aggregation, we employ cold chain to maintain the quality of the fish, and then we also make sure that they reduce their post-harvest losses while they're at it, because a lot of these farmers don't have access to cold chain. They cannot afford it. And then we process the fish and distribute to the traders. Majority of these traders are women. We leverage on technology for the efficiency of the value chain. We have a digital platform. It has 3 parts. So the first part is a procurement platform where the farmers can access quality inputs. And then we have a smart farming tool, which encourages the farmer to rely on data for climate smart farming. And then we have an e-commerce platform. And this platform is where the women traders can be able to access a larger market than the traditional walk-in customers that they rely on. Our impact is huge. We are able to produce affordable quality fish, which has a significantly lower carbon footprint than other sources of farmed protein. In addition to that, we have been able to mobilize 50 farmer groups. Each group has about 20 to 30 members, and supported 600 women to get into fish farming, employing 39 full-time staff. In our network, we have trained 2,000 smallholder traders and farmers, and we are on track to produce 1,000 metric tons of fish this year to positively impact 3,000 value chain members. We cover 8 SDG goals through our initiatives. Unlike the competition at Rio Fish, we are building holistic centers of excellence for franchising in Africa's fish value chain. Sorry about that. Last year, we had revenues of $880,000 US, and this year we are targeting $1.1 million US. Our roadmap to success looks like this. We're going to digitize the value chain, have innovative initiatives, expand geographically, offer new products, and also have strategic partnerships. The opportunity is huge. In Kenya alone, the supply deficit of fish stands at over $500,000 US, and in Africa, this is 10 times the amount. We have so far raised $1.4 million US, $1 million from the directors and from bank loans, and $400,000 from a grant we recently got last year. With additional funding, we are going to be able to recruit more women into fish farming through cooperatives. We are going to boost their production efficiency, thereby increasing their supply. We are going to give further access to cold chain so that we are sure that the fish is quality when it gets to the market. And we are going to onboard more traders and farmers onto our mobile platform for the efficiency of the value chain. Our board is made up of experts in their field. I'm a finance professional, and we have strategy, human resource, and we leverage on very professional staff for efficiency of our operations. We have strategic partners who help us with the funding and regulation aspects so that we are sure that our business is bankable and it's able to scale. We request that you join us to support this sustainable aquaculture venture to reduce gender vulnerability and improve economic vitality. Thank you.
Thank you. I'm glad to have the opportunity to listen to your presentations again. It's a very impactful solution, and the question I have is around the risks in aquaculture production in Lake Victoria. Would you be able to provide more information about the risks you have considered in terms of the production?
So the largest risk I see is the environmental risk. And sometime last year, we had a lot of fish kills on Lake Victoria, but those fish kills were largely avoidable. They were down to poor fish husbandry because those people who are affected by that were people who had situated their cages in the wrong areas, in shallow bay areas. For your cage, you need deep, clean waters, and the depth between the cage and the bottom of the lake should be, if the cage is 6 meters long, then between the cage and the bottom should be at least 12 meters. So most of these people were situated in very shallow areas, and that's one of the things that we make sure that we train our farmers on. I can confidently say that Rio Fish and our partner farmers did not have any fish kills in that season.
Thank you so much. Could you break down for us a little bit your revenue generation between the different fish products and some of the other services that you offer, like consulting?
So majority of the fish in Kenya is consumed whole. So I would say like up to 70% of the fish we sell is whole fish, just whole chilled fish. And then we have value added products. So the whole chilled fish attracts a margin of about 15%. And then the value-added products have margins around 40 to 50%, and that is where we really want to focus because we can then target the upper to middle class Kenyans. And then for the consultancy, we don't charge for it because it's a service we provide to the farmers we are working with so that we can be able to have quality fish.
Thank you for being here, Angela. It's a great presentation. I think in your network, you have farmers and traders. Can you talk a little bit about their ability and their opportunity to increase their income through working with you, and be as specific as you can in terms of numbers?
So for the farmers, the average cost of production of a kilo of fish, of tilapia in Kenya right now stands at about 190 Kenya shillings. Now, 70% of the production cost in fish farming is feed. So with the efficient use of feed, and we have seen that when we use data-led smart farming, you know exactly how many fish you're feeding. We've been able to reduce that cost by 20%. And we know that we shall be able to reduce that further as farmers continue to adopt that. Now, for the traders, a lot of them have been traveling long distances to go and look for the fish and spend days away from their businesses as they look for fish. So we bring the fish closer to the trader. And these traders have been able to reduce their cost significantly by up to 40% because first they're getting good quality fish. They don't have to store the fish because we deliver fish every day. So they can rely on us to bring to them fish every day. So they don't have to invest in any form of cold chain. And then they're able to fetch better prices because of the quality of fish. So I would say that they're making up to 40% more than they were making before.
Can you just put the 40% in terms of a Kenyan shilling amount?
So a typical woman trader would sell about 20 to 30 kilos of fish every day. And that's a good trader. So they're able to increase their revenue by at least $300 annually.
Okay. I thought about doing
Hi, my name is John Carl, CEO and co-founder of Soma Life, the fastest growing social enterprise that is on a mission to sustain income and impact for rural farmers in West Africa. The key problem my team and I observed is extreme poverty among smallholder farmers. There are over 16 million share producers in West Africa who live on less than $2 daily. There is a growing demand for share and the other agro-commodities that they produce. But these farmers and other market players remain fragmented and undigitized. Additionally, there are changing sustainability and fair trade requirements that they struggle to meet. So the farmers continue to live in poverty and the market lacks the technology to engage with them. Soma Life solves this for both parties with our proprietary software TreeSight, creating economic value and climate resilience for them. With our software TreeSight, we digitize the operations of smallholder farmers, we enhance their climate resilience through conservation activities, and then connect them to international market. We mark up their quality commodities with a margin of 30%, which is how we make money. We started our journey 4 years ago with only 500 farmers from one of the poorest districts in Ghana. By the end of 2023, we had connected over 15,000 smallholder farmers to the international market who earned 22% extra income above local prices. Right now, 65,000 smallholder farmers have subscribed to our platform and 93% of them are women. We ended our first year with a revenue of only $2,000. After another year of extensive market engagement and model validation, we increased our revenue to over $100,000. By the end of 2023, we had grown our revenue by 30x, proving the scalability of our model and the market potential. Ultimately, by 2030, our goal is to connect 1 million smallholder farmers to global markets. I started this bold mission with my co-founder Mause, who has 7 years of experience in rural development. I am passionate about agri-tech and rural development, having managed and scaled innovative farmer projects over the past 10 years. The management team is made up of young men and women who are poised to improve agricultural supply chains in West Africa. All of our last mile engagements are delivered by our network of agents who are youth recruited from our operational areas, determined to make a change in their communities. Join our mission.
Hello, everybody.
Hi, can you hear us?
Yes, I hear you clearly.
Fantastic. That was a good presentation. Thank you. I have a question about the impact on the farmer's income. You mentioned a percentage of 22. Could you put that in terms of an actual increase in income in dollars on a monthly, on an annual basis?
Yes, thanks for the question. So the figure we mentioned, 22%, is actually how much extra smallholder farmers earn from us compared to what they would have earned from the local market if they sell their commodities to the market. So on average, smallholder sells about 300 kg of share to us, which is about 1,500 cedis, about $150 in a season. And the point we're trying to make here is if they opted for the alternative in selling to the local market, they would have earned about 22% less than that. That's just the metric one of the metrics we track when it comes to our economic impact.
One quick follow-up. You mentioned in terms of seasons, this product. Is it 2 seasons?
So with share, which is the main commodity that we are focused on, it's 1 long season. The production happens in the second quarter of the year, and the trading activities start from the third quarter up until the first quarter of the next year. So about 9 months of trading, and that's just the season for share. But then there are other commodities that farmers produce, which we support with, like soybeans and maize, which have, a different production calendar, but they're all, one season each.
Thank you, John Carl. You answered already a second question as well that we had on other commodities. Can you explain a little bit about the revenue streams, the different ones that your company, and how important each one of them is? So you're trading in butter and in nuts. Yeah, what are the most important, and where are you in your financial development? Are you EBITDA positive? Are you making profit? Where are you?
Right now, our main source of revenue is the trading of commodities, the raw commodities. So we have shea nuts, soybeans, maize, shea butter. There are other opportunities that we are exploring. If you saw from the presentation, the software or the digitization services is one. So there's a potential for us to, generate revenue from that. And then also there's opportunity to monetize the conservation activities that we take the farmers through. Currently, it's a pure impact activity, but there is room for us to, earn revenue from that. But right now, it's all from the commodity trading activities. We are EBITDA positive. We've been profitable since 2022. And we're profitable in 2023 as well, albeit with a small, just about 2% net profit. And we hope to improve that through the additional services that I mentioned to work on in the short to medium term.
John Carl, the time is up. We're not allowed to ask any more questions, but thank you for your time.
Thank you.
Hello, everyone. My name is Ashley King-Bischoff, and I'm the founder and CEO of Sprout, an insurtech that builds solutions for climate resilience. Climate poses a major threat to the over 500 million smallholder farmers around the world, growing most of our food. Extreme weather, pests and disease, they're threatening about 20% reduction loss. Could you imagine, like every Friday we can't have coffee because of food shortages? This is a really big issue around the world. And yet in Africa, farmers don't have access to insurance. Insurance companies can't build profitable products, and farmers that are low income find the risks too expensive to cover with their income. So Sprout introduces a novel model that reduces the cost of insurance and also builds climate resilience at the same time. So we leverage two in-house products that we use and build ourselves. One is indexed insurance. It allows us to really focus insurance on climate risks that farmers just can't overcome, like widespread drought. And we also have built a novel, adaptive, mobile-based technology that gives farmers weekly information and weather alerts so they can manage things like pest and disease on their own. And Sprout's competitive advantage is that we leverage technology and satellite data using the internet to build really innovative tools. For example, this AI-derived coffee cropland mask that we made with NASA Harvest. Yes, NASA. And we integrate that with historical production data that we collect with farmers to make really thoughtful tools that precisely understand the risk of climate on crop production. And we plan to do this with all kinds of crops, particularly ones in global value chains like coffee, cocoa, rice, and tea, to protect 1 million farmers by 2030. We do that by working in the cooperative model, reaching thousands of farmers at a time, and with global partners I'll introduce you to that really care about this sector. Sprout started as an endorsement through the Climate Finance Lab, and then we spent the last few years doing R&D that was grant funded by groups like USAID, DIV, and others. We've been featured in reports by BCG and Google, page 20, on our use of climate and AI. We also interviewed lots of buyers, including coffee buyers, and we decided to launch in coffee in Kenya through a program we call Climate Smart Coffee. And this year we have made our first insurance product, and we've launched it. 1,000 farmers are covered this season. 9,000 are on the wait list. It's really exciting, and it's underwritten by Liberty Mutual Insurance. CGIAR has also provided funding for us to increase our impact on women's participation in ag tech this year by 30%. What's really interesting about this is insurance is not only good for protecting farmers, it can also de-risk climate financing. We've seen that farmers can not only increase production if they have access to climate smart agriculture, but they can also earned revenue off of carbon credits. We aim to show that for every dollar spent, $3 in farmer revenue is earned. And that's why USAID has given us funding to study this very impact. What's also really exciting is that this not only helps farmers, it can reduce the cost of insurance over time. So Sprout makes money by charging a fee off of the insurance premiums that go through our programs at 30%, which we've proven in our first product. We also earn a fee on programs and fund management where we're leveraging our insurance to provide more access to financial services for farmers. And with $1.3 billion estimated in 5 years for climate financing, there's a really large market to tap into. We find this lucrative not only for Sprout, but also for farmers. I think we have a really great team we've built so far. I'm a seasoned startup teammate. This is my second ag tech venture in Africa that I've built, but I've also worked for unicorns that have been wildly successful, like Yelp and Zipline. I know how to hire really great teams. This is an example of one. We even have someone here who's planted 900,000 trees in Kenya already. So if we were to receive 70K today, we would actually introduce the Coffee Climate Fund. We'd aim to plant 10,000 trees in the backyards of coffee farmers to increase their resilience and bring potentially $200,000 of revenue back to them in a number of years. Thank you so much.
Can you hear me? Yes. Yeah. Hi. Thank you, Ashley, for the presentation. Can you talk about affordability of the service, especially as you're targeting smallholder farmers? And how do you ensure it is, my understanding that the cost is subsidized. So for the first few years, how much is that subsidy, and therefore what's the overall cost to the farmer? And then whether it's feasible, whether the farmer will be able to pay the full price after X number of years?
Yeah, that's a great question. I think we can all agree that climate change is not affordable for small-scale low-income farmers. So immediately they do have a desire and an interest in buying insurance. We've interviewed, I think we're at 700 farmers this month in our baseline survey, and everyone understands and recognizes climate is an issue and they'd like insurance, but they don't have available cash for that. So we're looking at maybe like $10 per farmer of wanting insurance, maybe a few dollars of being able to afford it. We also ran a pilot in really early days, and farmers were spending like maybe 50 or 100 shillings, like 50 cents or $1. So we subsidize not only to provide actual protection to farmers, which a lot of concessional financing is interested in, but also because farmers need to familiarize themselves with insurance. Lots of research shows that if farmers see things, then they adopt them. So we have a 3-year model where we'd like to subsidize quite heavily, up to 100% for 3 years, while carbon credits can start accruing and farmers can build more resilience. Regenerative farming also takes 3 years to become profitable. So yeah, it's a really expensive upfront model, but we think after 20 years of being in that new state, farmers will start to be able to purchase 30 to 50% of the insurance premiums.
Thank you so much. That was terrific. My question relates to your technology. So the data and how you use that is all certainly impressive. I could see the value there in lessening the cost of insurance. I'm interested in the extent to which you are really focused on just aggregating the data, getting access to the data, versus to what extent, if any, have you developed your own proprietary intelligence around that data?
This is a great question. Okay, I love the software and data part. Well, I've been in Kenya since 2015, and I really believe that you have to collect data from people who are actually buying from farmers, which a number of people here are, right? That's real data that was purchased. So the cooperative model does allow you to collect real production data, which is very useful for us in making these models because we want to see the impact of climate on production. Our climate data is actually proprietary because that map we built, we filter satellite data through that to tell you what coffee rainfall looks like as opposed to just rainfall in the area. We can get even more granular with high resolution maps that we're building with NASA Harvest in a second phase. So yeah, Sprout ends up having like really unique indexes that we can put into our insurance product, which is why Liberty Mutual is like really excited to work with us. So over time, we'll build up more proprietary climate data. Yeah.
Okay, so can you give me a specific example of how that data that you have that is so unique, how that actually affects different outcomes for a farmer? How does a farmer get advice from you that like it's going to rain or it's not going to rain? What does the farmer do about that? Or some
So
other example?
farmers historically have farmed on a crop calendar. Many countries do this. They say January do this, February do that. And now January rains don't look the same, February doesn't look the same. Farmers are like, what am I supposed to do? So now if you actually know the genealogy of a crop, you can say, oh, you're 3 weeks into the flowering stage and it's not raining. Do this instead of doing that. We're forecasting lots of rain coming. Don't spray and wash away half of the inputs you've provided, right? It's like really hyper-localized weather information tailored to the agronomy of the crop. So we get really nitty-gritty in the coffee agronomy when we give that advice. That's different from the insurance, which was the filtering, yeah. Okay, my time's up, thanks.
Hi everyone, my name is Ashley Spire and I'm a founding team member of Kazi Yetu. I've spent the past 15 years living and working in East Africa, and one of my fondest memories is filling a 20-foot shipping container with 20,000 tubes of tea, hand-packed in our women-run factory in Dar es Salaam, on its way to Germany. Unfortunately, exports like this are rare from Africa. Despite making up over 18% of the world population, Africa only accounts for less than 3% of global trade. Kazi Yetu is on a mission to change this inequitable dynamic. We are a women-run agribusiness that creates a range of products that are fully produced in East Africa for international markets. Tanzania Tea Collection is our flagship product. We have 8 different tea blends, and we just launched a new range of smoothie powders. Currently, we're selling across over 200 shops in Europe, the UK, East Africa, and most recently in the US. We've achieved a 125% revenue growth over the past 3 years. In 2023, our revenue was $325,000, and we broke even in Tanzania. In 2024, our revenue is on track to hit $600,000. We're well positioned to take advantage of an $18 billion market size in tea in our key markets, and a $9 billion market size across tourism in East Africa, where we're selling to high-end shops and duty-free stores. We achieve all this through our model, where we source raw materials across 16 different value chains, reaching over 10,000 farmers. We then aggregate, blend, and pack in our women-run factory in Dar es Salaam. And we do the packaging in East Africa to promote local value addition, so more of the profit from your cup of tea stays in the country of origin. And finally, we sell through our global distribution network, both to shops, but also direct to consumer. Recently, we achieved an important milestone to extend value addition at the farm level. We set up the first cooperative-owned tea processing factory in Tanzania. Because of this, farmers have gone from making 15 cents per kilo selling raw tea leaves to now being able to make $6 per kilo selling orthodox processed tea to Kazi Yetu. What's more, the factory is fully women-run, which is rare, as women are often restricted to tea plucking only. Across the rest of our value chains for our tea blends, we're promoting regenerative agriculture. For example, we are supporting farmers with intercropping to promote biodiversity, and all of these practices are traceable through the QR code on each tube of tea, which consumers can scan, and this is a key competitive advantage for us. We've accomplished all of this through a strong team. Based in Tanzania, we have over 25 team members, 81% of whom are women, and our production capacity is strong. We're producing over 10,000 tea bags per day, and we are ready to scale even further. So we're raising $400,000 to fuel further expansion and growth for sales and marketing, to obtain certain certifications to help us unlock new markets, and for new product development. So cheers to empowering women in agriculture and to getting more amazing products from Africa on the map. Thank you so much.
How do you plan, what is your market plan to scale, and what does set you apart from the competition?
Yeah. So right now, in terms of scalability, Our priority markets to start off were East Africa and Europe. And now we just launched in the US, so I set up the US entity at the end of last year. And we, our strategy now, we have over 3,000 tubes of tea in the US, so the first step was really establishing a presence here on the ground. And now we're partnering with kind of local distributors to get into smaller grocery stores and supermarkets, not necessarily like nationally for Whole Foods, and that's another conversation, but and then also we're selling direct to consumers. So you can actually go on our website right now and purchase tea. And so, and I think in terms of our differentiation, what we found actually is our value proposition is different to customers depending on the market, right? So in Europe, a key differentiator for us is the traceability, especially with emerging regulations in the EU around traceability. This is very important to consumers and to supermarkets. And luckily, we are the only tea company that I know of that is fully traceable. And then in the US, what we're seeing is that consumers are really concerned with quality. And our unique herbs and spices from Zanzibar, which is a spice island, and from Africa is a key differentiator for us.
Yes, thank you for the presentation. I really want to try the Choco Cocoa product. That looks great. This is a question on the environmental impact lens side. You mentioned regenerative agricultural techniques. You're a relatively small team, so how do you disseminate efficiently those types of techniques to help your farmers? And somewhat related, I think, traceability is very important to your product. Can you give us some detail about exactly what goes into the traceability components?
Yeah, great question. So we have a supply chain coordinator on our team in Tanzania that is responsible for kind of managing relationships with, we have like 20 primary suppliers, and then within those suppliers, there's cooperatives, small farmer groups, and agri-processors. And so, I mean, what we found is that, for the time being, having kind of one team member that's really responsible for that is working well, but we're a huge into partnerships with, other organizations that are on the ground that, are already working with a lot of these farmer groups and cooperatives that we've, plugged into. And then in terms of the traceability, so because right now, we have 20 suppliers, and then, there are 10,000 farmers that make up, those suppliers, we collect data every year on kind of farm profile characteristics and practices. And then we've built a back-end system where it's connected to our kind of ERP database. We worked with developers, we got a grant to do this. So it's all real time. So as soon as ingredients enter our warehouse in Dar, we enter the information about the batch, where it was from, and then we're able to put that into our system, which then goes directly to this batch number, which is on the bottom of the tube of tea, and consumers can scan that. So it's all updated based on the batch.
Hi, everyone. I'm the last one up. My name is Natalie Casey. I am the Chief Business Officer at Coolbox, where our mission is to make sustainable cooling accessible to all. Last month, I was in Lagos, Nigeria, and I visited one of our first customers. Her name is Mama Ibadan. She's a fish trader in Ijora Market. And when I asked Mama Ibadan about her Coolbox solar freezer, she said, "I can't tell you how much this product has impacted my business and my life. I can't tell you the number of times I used to have to throw away my fish at the end of the market day because I had no place to store them. I now save money and I sell more." So it's clear that this product, this solar-powered refrigerator, has a huge impact on Mama Ibadan. But why is that? With a population of 1.2 billion in sub-Saharan Africa, nearly 600 million people live off of the grid. And that means that only 17% of the population have access to refrigeration. And while solar-powered refrigeration could be an alternative, there is still a big financial barrier. Of access is a big problem. And so what that results in is a wastage of nearly 40% of food that's produced is lost, in large part due to lack of cold storage. So how do we solve this problem? At Coolbox, our Cool technology is one that offers 24-hour refrigeration by storing energy in the form of ice. It eliminates upfront costs and displaces the use of diesel generators. And so by combining solar refrigeration with pay-as-you-go technology, we're able to offer innovative financing or financial options to our customers, many of whom are women, and many who are accessing finance or credit for the first time in their lives. So we're able to for as low as $20 per month, give access to 24/7 cooling. And what our customers tell us time and again is that they experience increased sales and improved profits. In fact, 9 out of 10 of our customers report an increase in income after acquiring one of our products. Mrs. Adranoye, she's a restaurant owner, she says, "Ever since I got the Coolbox, my profit margin has increased. My life has been made easy, and I make my monthly installments with ease." So far, since 2020, when we launched our first solution, we have deployed nearly 6,000 units across sub-Saharan Africa. That represents a total market size for us of 3.1 billion, and it's growing at a rate of 10% per year. Our initial focus has been primarily in Nigeria, and now we're starting to expand into new markets like Kenya and Uganda, with others on the horizon. But I think importantly, it's really critical to understand the impact that we're going to have with Coolbox and so our solar refrigeration solutions. By 2027, we intend to reduce food wastage by over 14,000 tons, avoid greenhouse gas emissions of over 245,000 metric tons, and empower over 138,000 women. Women like Mama Ibadan. This picture is from the first day that we installed the product into her shop. And you can see that the others are looking on in excitement and anticipation, maybe some skepticism of how is it possible that the sun can bring this cooling and to cool my fish. Our dream at Coolbox is to democratize the way the world experiences cooling. And we want to invite you to join us in our mission to make sustainable cooling accessible to all. Thank you.
Thank you, Casey, for the wonderful presentation. So is it that there is no other solar-based refrigeration product on the market? And if there are others, what makes the Coolbox stand out? And then maybe the follow-up question on that would be, how long is the product designed to last, and who is responsible for maintenance?
Okay, thank you. So we would say that the most common, say, alternative to solar refrigeration are traditional refrigerators or freezers powered by diesel-powered generators. So that's what we see most commonly in the market, is that that system is widely used, and so we're offering this solar alternative. There are other solar-powered refrigerators and freezers on the market. What makes ours different is, first of all, the pay-as-you-go. So there's technology embedded into the freezers that enable the customers to be able to pay over time. In our current model, we're offering financing up to 24 months. So having that embedded pay-go, I think, is a key differentiator. And then now we're starting to see new entrants into the market who are starting to use a pay-go model, some with an embedded technology, others not. And what we see is that our offering today is really squarely serving the small business owner. So we're looking at productive use for our cooling solutions.
Thanks very much. I love the solar fridge and all the stuff that goes into it. I want to focus on the other piece of your model, the pay-as-you-go. As I understand it, you added that on, a little bit into your. Did you? I don't think you started with pay-as-you-go, did you? Was it always that way?
Yes.
Okay.
Yes.
So then, can you tell me a little bit more specifically about your pay-as-you-go model and how specifically you're monitoring your the delinquency and the defaults, and if you're monitoring how it's evolving over time? I'd like to know a little more how you're monitoring that.
Sure. So in our pay-as-you-go model, we have about 20% of our customers who are actually paying in cash, and the other 80% are choosing the pay-go option. It's actually a lease-to-own model, so the customers pay a down payment upfront of 35% of the total system cost, and they can choose to pay in up to 24 months of the total balance. We charge an interest rate of 2% per month, and so there are interest charges as well as the kind of principal charges of the system. We are using our CRM system to be able to monitor the payments and repayments. Currently, we have a PAR 30 plus of under 2%, having deployed in Nigeria nearly 5,000 systems.
Maybe just to emphasize the second part of the question, which was how long is the product designed to last and who is responsible for maintenance?
Yes, so thank you for reminding me about your second question, yes. So the estimated life of our products is 10 years. We offer a 3-year warranty for all of our systems. And we have a full service team in Nigeria of over 160 employees who are responsible for the sales, after sales, maintenance, installation. So we have in-country support. And we're in the process of launching a new assembly facility in Nigeria. So we're really having our roots in the country so that we can more integrate both our supply and as well as our service to customers.
Sorry, I know you're tired of seeing my face. First of all, amazing. I mean, if that doesn't inspire you to want to go support these guys, I don't know what does. It was just completely fantastic. The other thing, again, I mentioned this earlier, but I'm so pleased to see so many women represented. We are all painfully aware of the fact that greater gender parity unlocks a huge amount of economic potential, and yet, boy, we're just struggling to get there, right? Which is a great way for me to actually introduce, we have a panelist who's going to join us while the judges deliberate, just before we make the final announcements about the winners. So you guys have to sweat for another 15 minutes or so. But I want to let you know that we have a very special guest who's going to join us, Greta Bull. Greta is the Director of Women's Economic Empowerment at the Bill and Melinda Gates Foundation. She is someone that I admire tremendously. She is a technical expert in development in her, over a long career. Just before joining the Gates Foundation, she was the CEO of the Consultative Group to Assist the Poorest, which is part of the World Bank Group. She is a leader in our space because she really uses her voice to highlight what's working best, and also to explore the things that aren't working so well, and really helping to galvanize investment around that, because she has an insatiable curiosity for figuring out how we make it better, and an acknowledgement that we haven't figured it out yet. And I think that that's such an important quality in a leader. So Greta, are you with us yet?
I am with you.
Yay!
Good afternoon.
Good afternoon. So we have a really strange setup, and I'm going to be hugely tempted to turn around and look at you because you're actually behind me. But I'm going to keep my focus on the audience. We have a ton of amazing people here, and we have gone through these pitches by these incredible social entrepreneurs. But what we want to talk to you about is what do we need to do in order to drive funding into creating gender parity or improving the representation of female entrepreneurs. So, I gave a little bit of context just before Greta joined around the importance of gender parity. We know that women lag behind. And so, we had 317 companies that applied. We have a ton of female leaders represented in the room here, but we know that we need to invest more. In your view, what's the case for providing more funding to female entrepreneurs?
Well, thank you so much for asking me to join for this. And I was able to listen to the last couple of pitches. So really interesting to hear what people are focusing on. I don't know, it seems crazy to even have to answer this question because women are half the world population. And so, we know that about 2 to 3% of venture funding worldwide goes to women. It cannot be the case that women only have 2 to 3% of the good ideas, right? And if we want to build economic growth in the markets that we care about, we won't get there if half the population is sitting on the bench. And that is unfortunately the case in a lot of markets. In South Asia, labor force participation is really low. In Africa, it's high, but women get paid very little for their labor compared to men. So we need to find better ways to get capital to women so that they can invest in their good ideas. But we also need to find ways to buy women time so that they can actually realize those good ideas. And the conversation here is more about seed capital. But this is just as true for credit, where FINCA obviously has a really long track record. And credit is also quite unavailable for female entrepreneurs. And when it's available, it tends not to be available on the same terms as men. And the evidence base is pretty clear on this. When women have better access to capital on more affordable terms in ways that meet their needs and suit their businesses, then you do get much better impact. And so I think just sort of understanding the case that women are important to economic growth, full stop, but then that you have to get women the tools to be able to deliver on their visions for running small businesses. It's just going to take efforts across multiple verticals, but it's as important in our markets as it is here in the United States. So I think we have a lot of work to do on this.
I agreed. So you talked a little bit about driving the funding. It seems like we do still have a disconnect in terms of the demands that investor capital is really, I would say the returns that investor capital is really looking for versus the economic realities of building these sustainable and scalable businesses in the environments that we're working in. What do you think we can do to improve that alignment?
Oh gosh. Yeah, well, let me start with this in a slightly different way. I mean, there are different kinds of investors, and I think those investors put you in a straitjacket in different ways. So maybe let me talk about some of those different perspectives and then get to how we might want to think about doing this in a different way. So, we're seeing a lot of fintechs right now that got really overextended when VC money was flooding into our markets because the emphasis was on scale over positive unit economics. And so all these guys, that ran out and sort of built as much scale as they possibly could without paying attention to the unit economics are now having to right size to get themselves through. And some are not going to make it. And we've seen some not make it. So I think that sort of investment incentive has driven folks in one direction. I think, FINCA and other MFIs and financial institutions have different constraints. So they get a lot of funding from DFIs or microfinance investment vehicles, and that comes with different constraints. So, serve low-income people in tough markets, but don't take any risks so you can pay us back. And that can be pretty impossible to do. I've been watching the microfinance space for a long time, and I think the decision was right to commercialize and tap into more private sources of capital to reach scale, but that comes with some pretty fundamental tensions between having development impact and delivering returns to investors, right? So I think the DFI world was kind of seduced by the strong returns on exits on institutions like Comportamos or Bandan and thought they would make a ton of money in microfinance. And I think a moment's worth of examination tells you how unrealistic this goal was, especially when, you know, a lot of donors are pushing institutions to work in super tough markets like, say, the DRC or Liberia, Haiti, Afghanistan. So I think there needs to be a recalibration of return expectations and what development finance can earn by providing financial services for the poor. Because I think the flip side of that is in recent years, we've seen a lot of DFIs and other investors being really pleased with the investments that they've made in digital consumer credit, which, you know, has some downsides, right? And we have subprime lending here in the US too, right? But I'm not sure this is something that government funding should be super proud of supporting, right? I think we should be really focused on productive credit that helps people build businesses. And then maybe let me just say one thing about the obsession we've had in recent years on scale, which I think can also be a bit of a trap, right? So there's definitely a minimum scale that you need to get to as a microlender to make your business robust, stable, viable, et cetera. But then kind of M-Pesa came in and took everybody's breath away thinking, right, that's the kind of scale we want to get to. But again, if you take a moment to reflect on this, you can sort of see how maybe we're not comparing the right things, right? So if you think about the scale that a FINCA would get to versus a scale that an M-Pesa would get to, or even a bank, you know, like Equity Bank, they're never going to get to the same scale as a payment system. Think about how MasterCard and Visa work, right? They're both payment systems. Their members are banks. Their scale is much larger than that of any one of their member banks. So expecting that kind of scale to come from a bank or from a microfinance institutions is kind of like comparing apples and alligators, right? So we need FIs to get to enough scale so that they can withstand turbulence in the market and bring their unit costs down. There's no doubt about that, and there's very clear evidence on that. But that's not the same as the kind of scale you need to get a payment system to work. That's where you have huge scale with little tiny incremental revenue sources, right? So I think in the financial services space, particularly around credit, it's better to focus on building a sustainable business model that you know has impact, and then to prudently scale it over time. And that requires a different approach and a little bit more patience. You definitely need to scale it, but if you rush it, you end up with digital consumer credit. And I don't want to pick on those guys. There's a role for digital consumer credit. It's not the same as productive credit, and I don't necessarily think donor funding should subsidize it. So I think it's about calibrating and thinking carefully about what scale looks like in different industries and how we make sure that we're building to an appropriate scale and building in appropriate return expectations when we're also asking people to work in very tough markets.
Yeah, thank you. And I actually want to come back to that a little bit. I know that when we talk about subsidy, everybody sort of gets hives, but the reality of it is that, you know, donor capital, frequently we are talking about a subsidy, right? And so going back to what you were talking about in terms of tempering return expectations, is there a more explicit role for donor funding to create a more patient environment that can lean further into social impact?
Absolutely. Let's be honest. Subsidy sits in the United States financial system. Why do we think we all get 30-year mortgages at fixed rates, right? We subsidize a lot here. We have CDFIs to finance communities that don't have access to finance. So I think we've all kind of got a little bit dogmatic on the subsidy question and need to just think about what the appropriate use of subsidies is. It's a different conversation. But this is a huge topic, and I'm just going to do a little teaser for a white paper that we have coming out on this topic in a couple of weeks in advance of spring meetings. And I think we have to talk differently about credit and about the equity ecosystems. So let me just start with credit. And I have a particular obsession, as you well know, Andre, with credit in Africa, because I think we have a particular problem there. And it's an ecosystem problem that really needs addressing. And, you know, we forget that we threw a lot at building inclusive credit ecosystems back in the day and in successful markets in Latin America and South Asia with donor help. And I think we need to do the same in Africa so we can start tackling some of the drivers that keep the cost of productive credit high in Africa. And that's namely around, high operating expenses, risk and visibility, the cost of capital. And the way we look at it is we see kind of 5 really important levers in this. So one is that, as you look at women, more women are in informal credit ecosystems, what we would call sort of community finance organizations. That could be VSLAs, it could be self-help groups, it could be SACCOs or chamas. And so if we want to get more credit to women, we need to think about where they are. And we also maybe need to think about why they might prefer those systems over formal financial systems. And then think about how we build pathways into formal finance, not for all of those women, but for the women who would benefit from individual loans to run a business, because a VSLA is not necessarily a great resource for running a formal, not even a formal business, an informal business, right? So how do we start sifting, and moving women who would be better suited in formal finance into that system? We don't have good mechanisms for doing that right now. But once you're in the formal financial system, then I think there are some things we need to really get focused on in Africa. So one is regulation. I think a lot of institutions are operating in a regulatory straitjacket, and a regulatory system that's easily arbitraged, for lack of a better word, right? So, fintechs don't have any regulation, but if you're a bank, you have lots of regulation, and it's sort of an uneven playing field. So I think what we need is kind of agile regulatory frameworks that have step models, so that you have institutions progressing across that step model with an appropriate cost base to deliver to low-income populations, but also appropriate prudential regulation as they start offering more services. And what we see in Africa is a lot of entities, just becoming banks when they're tiny and having to carry that regulatory burden. So I spent a lot of time working on microfinance in Peru, and I think they got this really right. We need that kind of more agile regulation with consumer protections that come along with that, because we saw what happened in Kenya when there was a cap put on some loans, and all the money rushed into digital consumer credit, right? That was probably not where we wanted to be. And the regulators couldn't even measure how much was going into it. We've got to get cheaper local currency wholesale funding out to entities on affordable terms. We need to make much better use of blended finance instruments and make sure that the benefits of that get passed on to borrowers. We need better, more digitized institutions that can meet their borrowers' real needs instead of producing cookie cutter products. They can grow with their borrowers, really provide them with the solutions that they need to deliver on their business goals. And then market infrastructure. I mean, data infrastructure is terrible in Africa. And so we need to build a lot better data infrastructure so that you have much more visibility into the credit risk that you're actually taking. And across all of this, we need to really work on interconnecting these different systems and building data systems that are, accessible by everybody, right? So I think there's a whole bunch of things that we need to tackle on the credit side. And this is important because most people access finance through credit, right? There's not so much venture financing available. And it's hard to construct exits, all those things. But on the equity capital side, I'll just say a couple of words. I think we need more impact first investors who are really willing to be patient, play a long game. So I used to work at the IFC, and our approach there was pretty much return driven, despite all the rhetoric about impact. And there is a focus at impact on the IFC, but there's more priority given to the returns that you're going to get on those investments. The thing that I really like about the Gates Foundation is our first concern is impact, and we're prepared to be very patient on returns so we can get to the kinds of impacts we want to see. And we're starting to see more and more philanthropies engaging in these kinds of ventures, either providing first loss capital in blended structures or making direct PRI type investments in companies with proven or promising business models. So I think we could be operating as donors and philanthropies across the board in a much more meaningful way to get capital into women's hands and to provide it with the kind of patience that's going to deliver in the tough kinds of markets that we're being asked to deliver in.
Excellent. So you touched on it a little bit already, but since we have these 12 young, amazing companies in the room here today, do you have any advice for them as they're thinking about what's the right type of capital to attract, and how should they go about thinking about positioning themselves? I know they're all very different, but I think there is kind of a general answer.
Yeah, so I'm operating in a bit of a disadvantage because I only heard 3 of the pitches. Yeah. But, I guess the first thing would be, persist. As Thomas Edison said, genius is 1% inspiration and 99% perspiration. And so if you have a vision for getting something done, you have to be pretty single-minded about focusing on that thing. You're going to face obstacles, and it's the perspiration that's going to get you through. And women obviously face extra obstacles, and that's harder to provide advice on. But in my experience, it's about saying a lot, powering through, and putting in the elbow grease. But I think there's also, and you're talking with women from different kinds of backgrounds, right? I mean, I think what we see in a lot of our work on credit, but this is true in the venture space, a lot of women lack confidence and knowledge to really invest in their businesses. And I think one of the reasons we see women taking smaller loans in the credit space, for example, is that they tend to be risk averse. And then we have a whole social norms issue that's a pretty big barrier in a lot of markets. We're looking at it in a lot of ways. Upskilling, digital tools like AI-driven chatbots on skills, bringing business to women's homes if women can't leave their homes. But I think groups are a really important aspect of this. So we see a lot, particularly in terms of building knowledge and confidence. So we see this at the bottom end in places like India with self-help groups or VSLAs, where people are just learning basic skills by participating in those solutions. I mean, I've seen women in self-help groups in India who are bookkeepers basically for small credit unions, and they're gaining a lot of skills by doing that. But in more kind of advanced spaces, women's clubs, like just kind of helping each other kind of understand that you're not alone, I think is actually really important. But then, a lot of women starting businesses in Africa and South Asia, things like childcare and labor-saving devices are really important. Childcare really gets in the way if you're trying to run a business, or the lack thereof. So, we're looking at this across a number of different verticals, but I think the most important advice for the women in this group is persist, keep at it, find those like-minded funders, and know that you're not alone. I mean, there are a lot of people trying to run similar kinds of businesses, and finding common cause with other founders, I think, is really important.
Common cause is really important. I know I take great solace in working with like-minded people, and it keeps me very motivated to do my very best. So we want to give you one chance. You always have more chances, but we have this great audience out here. We have a lot of investors. We have a lot of people who are very committed to social impact. We have all these entrepreneurs. Do you want to help us create a challenge for them around how do we create an ecosystem that's going to be more supportive of women founders?
Yeah, well, I think there are lots of things you can do. And some of them are things for FINCA to think about, and some of them are things for some of the investors in the room to think about. On the credit work, I'd love to see all of you do more with women. Women have very unequal access to credit. And I think we do need to really take another look at how we deliver this, particularly in Africa, so that we can build the kinds of institutions that are able to deliver credit to women in a form that they need. I think it's worth reflecting on how we end up with a microfinance space that started with women as the central focus, and then as microfinance institutions grow and evolve, somehow that starts involving a lot more men. So why is it that when institutions grow, the proportion of women in their portfolios shrinks, right? I think that's really worth interrogating, because in the background, we always say women are better credit risks, but then, that's not reflected in what we're actually lending against. And I think that's going to be true in the venture space as well. Like, what is it that we're supporting women to do here? And what do we need to deliver to make that work for them? I think sex disaggregated data across the board and understanding your women borrowers or your women investees and what they need and growing your products with them is really important. And I'm kind of amazed at how quickly we run into institutions that don't sex disaggregate. It's amazing. I mean, it's kind of the biggest differentiator. Like, if you think about it, 50% of the population is women. Like, that's a pretty important data point. So really understanding your customers and starting with sex disaggregated data, I think, matters a lot. And we're starting to see with some of our partners that are doing this, women are better credit risk by a considerable margin, and they're better at selling. So then what do you do to lean into that, right? Join the Financial Alliance for Women is another thing I would make a pitch for. So the Financial Alliance for Women, for those who don't know it, is a group of financial sector institutions that have come together to say we need to do better on lending to women or investing in women. And they do terrific work on sex disaggregated data, and they do terrific work on bringing together partners that are trying to do the same thing, right? So I think, just again, in the spirit of making common cause, that's a really good forum for finding other institutions. And they have microfinance institutions, they have banks, they have insurance companies, all kinds of different entities are part of that alliance. So just making a pitch for joining that. I think making the case to donors, particularly in some of the tougher markets that you're working in, to support some of the work that doesn't generate a return. So work around building better educated borrowers, more confident borrowers, borrowers who are more connected to markets. I think there's a lot of important work there. One thing I'm always amazed at is, BRAC does all this great work on ultra poor graduation, and they talk about it as though it's very separate from their microfinance work. It's actually completely connected and subsidized in Bangladesh by their microfinance work. But even more importantly, destitute women who are part of ultra poor graduation, more than 50% of them go on to take loans from BRAC microfinance on commercial terms. So what they're doing is they're kind of putting a floor under these women and giving them then an opportunity to really grow as entrepreneurs, right? So how do we kind of connect the dots between what is sort of traditionally thought of as kind of social protection and turn that into entrepreneurship, so people don't stay as kind of charity cases forever, they actually can grow their own businesses. And then last, and this is hard, but work with others. We just find people doing all of these little siloed things. And one of the things that we're making a case for in our white paper is we need to work together. So CARE does amazing work in the VSLA space, for example, but they have very few on-ramps to formal finance. You guys could be that on-ramp, right? And in your venture work, focus on female founders. They're out there, but it's harder to find them. And I think there's a case for funders to really help support institutions like FINCA and like others to really go out and do the hard work of finding those female entrepreneurs, designing the products that meet their needs, and really kind of nurturing that ecosystem. But it's going to take us all working together. The argument we're trying to make in the white paper is we can't all keep going, oh, equity bank's going to solve this for us. We need fintechs, we need MFIs, we need non-bank financial institutions, we need the consumer, digital consumer lenders, we need all of that stuff. But we need an ecosystem of lenders that have kind of cost bases that are better able to deliver to those customers, and where we have financing flowing in appropriate ways so that you're not borrowing at ridiculous rates so that you have to lend at ridiculous rates. Like, there's just an ecosystem problem that we need to solve in some of these markets that will make finance more affordable for everybody, and particularly for women. So that's my pitch for working together.
Thank you so much, Greta. As always, she provides in a very short time frame the most incredible overview of the key issues. You are wonderful, and we really appreciate you making the time to join us today.
Thanks for having me here, and good luck with the rest of the event.
Thank you.
Hi, everyone. I'm here to announce the decisions we've made for the healthcare category by local founders. It was a hard decision. Before the pitches were made, we ranked the companies, and then after the pitches, all of the judges had to change their rankings. So I think it's just testament to how close the decision was. So close to the point that we had to remind ourselves of the lens that we were, lens that we're analyzing these companies through. And that obviously is the social impact lens. So not only do these companies have to be financially viable, scalable, but they also needed to have a profound social impact. So based on that, the company that we ranked number 3 was Emergency Response Africa. And so this is the company that's seeking to provide access to emergency response in the shortest amount of time. And the one thing that really stood out to us about Emergency Response Africa was the complexity of the problem they're trying to solve. It is a hard problem to solve and to sign up all the public service providers. But we have no doubt that as they continue to scale, the impact that they will have will be profound. The company that we ranked second was Pelebox. So this is the company that's providing smart lockers for people to access the medication. What really impressed us about Pelletbox was the simplicity of the solution they're providing to a very real problem. So we felt that Pelletbox was the company that had a great potential to scale. So we're looking forward to hearing more good things about how you progress Pelletbox. Which means that the company that we ranked number 1 was Benacare. So Benacare is the company that's trying to provide home-based nursing services. And again, the problem they're trying to address is very real. Being from the healthcare sector myself, it is a very real problem they're trying to solve, I can say. But also the solution they're trying to create is a complex one. And they've done a great job so far. But what really stood out to us about Benacare is the impact that they're having today. Impact not just in terms of the impact on the community, but also the impact on women. So congratulations, Benacare.
Hello, everybody. I am here to present the winners for the Health American Founder category. So first, I wanted to start by saying, and I think I speak on behalf of all of the judges on my panel to say what an impressive lineup this has been today. Congratulations to all of you really, for being here and presenting your innovative, disruptive companies. It's truly been an honor and a delight to just have you walk us through the process. I'm here to announce the winners, so you all have seen the pitches. I won't go into too much detail or hold the suspense. So in third place in this category, we have One Health. In second place, we have Checkups. Which means our winner in this category in first place is Neopenda. Based on the judging criteria we were given today, Neopenda stood out to us as the only company pitching an innovative, affordable medical device that had the potential to have a significant social impact in low-resource settings. And we also really appreciated that the solution would be attractive to both the private sector and the public sector health facilities and a variety of consumers. Neopenda presented a clear business model today, and we think it has great potential for scaling up. So congratulations to Neopenda, and congratulations to Checkups and One Health.
Okay, hello everyone. First of all, congratulations for the companies who made it to this stage. Where the judges for the agriculture panel by local founders. And after a hard discussion, we decided that the third place in this category is Summer Life. And the second place is Bao Baby. And the first place is Real Fish.
Hello, everyone. Now, in terms of the agriculture category, U.S. founders, for third place, we have Coolbox. Sorry, I should say third place winner. And second place winner, we have Sprout. And first place is Cassie Yatu. Congratulations.